Hello everybody and welcome to another edition of Eyecare Today. I'm your host, Dr. Thomas Kislan, joined today by Dr. James Deom, who is now on his third year in our practice here in Hazleton and also in our Stroudsburg location. So if you're watching us from Hazleton, we're on the Beltway here in Hazleton. Phone number is 570-453-2020 if you need to get in touch with us. In Stroudsburg, 570-421-3342, and we're located on 9th Street in Stroudsburg. And as always, check us out on the web at www.drkislan.com. Thanks for joining us, Dr. Deom. We are going to talk about, on this show, a condition that affects 30 million people in the United States. Now, in our last couple of shows, we talked about glaucoma, we talked about macular degeneration, and these conditions affect about 3 million people in the United States. This is a condition that affects 30 million people in the United States. So we see a lot of patients every day. What are we talking about today?
We're talking about dry eye. And I gotta say, you know, I'm very, very lucky to be in this practice. Dr. Kislan, homegrown part of this community, is really a leader in the nation and in the world on dry eye. And the only reason I know anything about dry eye is because I was lucky to be here as a student, and I've grown my own passion for it now. But I have to say, I really didn't have that before I came here, and so I thank you for that. My patients thank you for that, and you know, let's hear a little bit more about it.
Well, you know, thank you. My passion for it probably started 20-some years ago when I decided to have LASIK. And, you know, I was one of those patients that hated my contacts, and I was really nearsighted, couldn't see anything. So I thought, what better thing to do than go get LASIK? And, you know, LASIK is a great procedure. The problem is there's a small segment of patients that it can cause dry eyes. And, you know, you see those commercials, you know, dry eye, and it, you know, it's kind of almost made fun of, but it affects 30 million people in the United States now. And for those who suffer from it, it can be a debilitating condition. And I suffer from it. I have severe dry eye, for me because of my LASIK, and that really has fueled my passion. And that's what has led me to, you know, I lecture on it, we do research here on it, we present that research, you've started lecturing on it also. So we're very active as far as this disease goes. And, you know, what I say to patients out there is, you know, some of the stuff we do here in Little Hazleton and Stroudsburg gets picked up and other doctors do across the country and the world because of what we do here. So I'm very proud of that, and you know, we now say that we can do that. So what we want to share with the folks out there today is what it is and what can we do for it, because there's just so much that we can do now for dry eye. So explain to the folks a little bit about out there about what dry eye is.
Yeah, I think the big thing that I always tell people when I'm starting the conversation about dry eye, and I don't always use this word, but it is multifactorial. What that means is it's caused by many things. No one thing causes dry eye. And so whenever we evaluate somebody for dry eye, and here at our office we do dry eye examinations where we're looking at dry eye primarily. And you know, some of the things we're going to be looking at is we're going to be looking at what medicines are you taking. What are some medicines that you know that cause dry eye? Well,
for one thing, in some of our female patients, birth control. Birth control is a biggie.
Big one.
Antidepressants. Medicine for allergies. You know, we're starting to get into fall allergy season now. So
Claritin, Zyrtec, Allegra, all those?
Exactly.
Okay.
High blood pressure medications.
Okay.
So a lot of patients are on diuretics. And think about what a diuretic does. It pulls fluid out of your body to help lower your blood pressure. Well, it pulls fluid, it also dries the eyes out. So there's a long list of medications that causes the eyes to dry out. But one of the biggest things, because we're seeing this so much now in younger patients, Dr. Deom, and again, it's your generation, not mine, I mean, but this thing here, okay? Everybody now is on a pad, a pod, some sort of device.
Right.
So when we, you know, blink, if we just sit here and chat, how many times do we blink a minute?
It's 20 to 30 times a minute.
Yeah. How about,
should be, right?
Right, right. And when we read?
A little less, 10 to 15 times a minute.
Right, and on a device, it goes down to 0 to 2 times a minute. So why is that important?
You know, I love explaining this to patients because I think I see the lights go on, they get it, you know. There is a line of oil glands, okay, on your lower eyelid, on your upper eyelid, and those two glands don't express their secretion into the tears unless they touch one another. The other thing is that the tears that are on the eye are very thin. It's unbelievable how thin they are, and if they're exposed to the environment, they evaporate away very quickly, leaving the surface of our eye exposed by the environment, and that should never be exposed by the environment. So the glands don't express, the tears evaporate, and we're in a situation where we start to itch, burn, scratch, tear. So, you know, it's a really a cycle that begins with not blinking.
And you know, that oil is so important. And the analogy I'll use with patients is, you know, think of an oil slick on water, or you know, you're washing your dirty dishes and that oil's laying on top of the water. That oil protects everything else underneath. And if that oil isn't there, like you said, everything else underneath just evaporates away. So that oil layer is just so important for preventing evaporation of our tear film. And you mentioned all the symptoms, but you know, from some of the research we've done here in little old Hazleton and Stroudsburg, and we were proud to be one of 16 sites across the country. We were the only private practice sites. The rest were places like Baylor and Hopkins and places like that. There was a study published that showed the #1 predictor of dry eye getting worse is actually fluctuating vision or blurring vision. So tell the patients out there watching what that would be like.
You know, this is such a big one, and I find that, you know, when I'm out talking to other doctors, and I know, you know, again, I got this from you, so you know, this is something that we find with patients is that when we're checking vision, you know, we're doing 1, 2, all that fun stuff behind the phoropter in the office, and we're checking to see if you're seeing good. One thing that we'll notice is that you'll read half the line, ABC, and then you'll stop. I can't see the rest. And we know that, you know, if you're able to see the first 3 letters, you should be able to see the last 3 letters, right? And then we'll say, you know what, patient, go ahead and blink a few times. Are you able to see the last 3 letters? And they'll say, oh yeah, now I can read the last 3 letters. And a lot of times I'll pull the phoropter away and I'll say, you know what? We have something else we need to deal with here, and that's dry eye. And I'll explain to them the oil and the blinking. And as you blink, those tears wash over the front of the eyes, and that they'll evaporate away quickly if we don't have enough of that tear there. And that's what's happening. So your vision is fluctuating and is huge as it relates to serious symptoms of dry eye.
And when we start having that discussion, patients will say, oh yeah, you know, you're right, I'll be driving home at night and I won't be able to see the road signs, but if I blink a couple times, it clears up. Or if I'm on my phone checking my email at the end of the night, you know, I blink a couple times, it gets better. So fluctuating vision is a biggie, and we need to take a little break here, but when we come back in the next segment, we're going to talk about, you know, what all this means and how we treat it and why it's important that we actually treat this. So you're watching Eyecare Today. We're talking about dry eye disease, and we'll be right back. Welcome back, everyone. You're watching Eyecare Today. I'm your host, Dr. Thomas Kislan, joined by Dr. James Deom. And if you're watching us in the Hazleton area, our phone number is 570-453-2020. And in Stroudsburg, for Stroudsburg Eye Specialists, 570-421-3342. www.drkislan.com. Check us out on the web. Dr. Deom, last segment we were talking about some of the symptoms for this condition that affects 30 million people in the United States, dry eye disease. And we were talking a little bit about fluctuating vision or blurring vision being one of the most common predictors for not only having it, but for it progressing. But you were right when you said, you know, my eyes, they could itch, burn, scratch, and tear. Now, a lot of patients come in and say, well, my eyes water all the time. And we mentioned about dry eye disease, and you're like, well, what the heck, how can that be? You know, how can my eyes be dry if they're watering? So kind of explain how that discussion goes.
Yeah, I think that's such a big one, and patients always are very confused about that. It is confusing. How could my eyes be dry if they're profusely tearing and dribbling down over my face? And that could really irritate the skin around your eye, cause some redness or changes to the skin around your eye. And so what's happening there is, again, back back to these oil producing glands, that oil protects the tears, keeps the tears on our eyes. If that oil is deficient, or if the overall amount of tears are deficient, then we have an exposed situation where the cornea is exposed to the environment. I always tell people the cornea, the front part of your eye, is the most highly innervated, meaning it has the most nerves, meaning it's the most sensitive part of our body. So it can sense if a tiny millimeter is exposed to the environment. It also can sense if something touches it. It does not know which is which. It doesn't know if it has a bug in it or if it's dry. It doesn't know. It just knows something's wrong. And so it has the same reaction to fix that, and that is to create a whole bunch of tears, water tears, not oil tears, water tears to get rid of that stuff. So either there's a little spot of dryness, the nerves sense that, and then a gland in our eye produces all these excessive water tears to wash it out. But the problem is it's not the right quality, right? We always talk about quality versus quantity. So I think when we explain that to a patient, they get it. You know, oh, my eyes they don't have the right quality tears. And because of that, the eye's trying to fix itself, but it doesn't have the ability to do that on its own.
And I use the term reflex tears. You know, our eyes are having a reflex to something. So kind of like you said, if a bug flies in your eye or someone pokes you in your eyes water.
Right.
That's a reflex. So the eyes are sensing something's bad going on, and the eyes actually are watering. So, you know, we put all this stuff together, and you know, again, we're one of the only, I think the only facility in the area that actually tests the tears for dry eye. And you know, the analogy I use is you go to the family doctor, they check your blood pressure, we check your eye pressure. You know, if you have dry eye, you should have your tears checked. And we actually do tear analysis in this office routinely on a lot of patients because it affects 30 million patients in the United States. And we've now learned that dry eye is not just a condition where you just take artificial tears for. In fact, you know, I'm almost to the point where I would say that tears do nothing for dry eye as far as treatment or preventing progression of it. So if you're out there watching and you're using artificial tears 3, 4, 5 times a day, you're on the wrong track. You need to come in and see us because we now know that dry eye is what we call inflammatory in nature. There's inflammation involved here. So tell the folks out there a little bit about what that means, inflammation.
Yeah, and I think it's confusing because I think a lot of times when people think of inflammation, they think of a broken arm, they think of big red swelling, painful, and a lot of times that's just not the case with the eyes. It's subclinical. In other words, you can't see it always, but we can, you know? And so some of the things that we look for to find inflammation are we put a stain on the eye, and that stain glows green when we put a blue light in front of it, and we can see little dots of missing cells on the eye. That irritates the eye. It causes inflammation or irritation. Some of these medicines that will reduce the amount of tears on the eye cause inflammation in the eye. Aging could cause inflammation in the eye. So all these things cause inflammation in the eye, and ultimately what happens is the body knows that something's not right, and it sends these cells, these special inflammatory cells to the eye, try and fix the problem, but almost always inflammatory situations in our body cause more of a problem. They reduce the tears that we make.
It's a big vicious cycle.
Cycle,
as inflammation continues to progress, and think of it if you twist your ankle, or you're a runner, just completed 3rd triathlon, you know, your knee's bothering you a little bit now. So a little bit, right?
A little bit.
You're getting a little older.
Yes.
So you're running on the knee, it bothers you. You keep running on it, it's going to get more and more inflamed. Or if you twist your ankle, anyone out there who's twisted their ankle, you got to rest it. But if you continue to walk on it, the inflammation increases. It's the same in the eye. That inflammation continues to increase. So, you know, we have some treatments, some great treatments out there for inflammatory dry eye disease. And, you know, I'm just again going to say that artificial tears is not one of them. Right. For me, artificial tears is a supplement to whatever else we're going to do. So what we do now is treat the inflammation.
Right, and we know that there's inflammation there because we have the technology to pick up on it early. You said about, you know, if you keep on going on a broken knee or a torn ankle, that you're going to end up feeling it. Same thing with dry eye. You know, we have these technologies now to test the quality of the tears, so we'll know if there's inflammation in your tears, and also by looking at it, we can see it before a lot of times you're feeling it. And then we're going to treat it so it doesn't get to that point where the eyes are red. We get people that come in, right? Eyes red, swollen, irritated. They can't open their eyes. That's how painful it is. Right. So we want to get them before that.
Right. And there's two tests that we do in the office here that no one else does. And very briefly here, I don't want to get too much in the weeds with this, but osmolarity is one. And the way I explain osmolarity is it's the salt concentration in the tears. And if your tears are more salty, that's a bad thing. Less salty is good. And then there's a second test where we actually test for those little proteins in the tears that come if there's inflammation, where it shows us if there's positive inflammation there. And the way I explain it to patients is if your osmolarity is bad, but you don't have inflammation yet, you're on the way. We need to treat you. If your osmolarity is high and your inflammation is positive, you're there. And we really need to treat you. Right. So we use this testing for a reason, and in the next segment we're going to get into the treatments for dry eye disease. But as we start treating patients, we see these numbers getting better. Right. So we'll see patients' inflammatory status getting better. We'll see their osmolarity actually improving, but the big thing is the patients start to feel better. The problem is, though, they don't feel better overnight. And what I explain to patients, and you've probably had this discussion, is it didn't get this bad overnight. It's not going to get good overnight. So it really can take 6 to 8 weeks in some cases to even start to feel better. And in the next segment, we are going to talk a lot about some of the treatments out there because there's just so much now we can do. So we're going to take a quick break here, folks. On the next segment, we're going to talk about the newest treatments that are out there for dry eye disease. You don't want to miss this. We'll be right back. You're watching Eyecare Today. Welcome back, everyone. You're watching Eyecare Today. I'm your host, Dr. Thomas Kislan, joined by the great Dr. James Deom. We've been talking about dry eye disease, and we've talked about what can cause it, what the symptoms are, how we test for it. But what's really exciting now, Dr. Deom, is all the treatments that are out there now for dry eye. And again, for me, artificial tears is not one of them. If you're out there watching and you're using artificial tears 4, 5, 6 times a day and not doing anything else, you need to come in and see us because that's really not what treats dry eye. Dr. Deom, what in the front of us here, we have a plethora of things that we can use to treat dry eye, from omega-3 supplements to some drops. Tell the folks out there a little bit about what we do to treat.
Yeah,
so
this. I think what's important is we work on what's called an evidence-based approach, right? Evidence-based, that means there's research and studies that have been done to show us if you have this level dry eye, this is where we go. If you have this level dry eye, this is where we go. If there's inflammation, this is what we do. If there's not, then this is what we do. So we don't just willy-nilly pick, we like this, we like that, we like this commercial, we don't like that one. There's reasons why we're doing what we're doing. Big, large studies, some of which Dr. Kislan's been a part of in our office we've completed. So, there's reasons why we're doing what we're doing. And so, with mild dry eye, we're often going to start with a drop, okay? Like you said, artificial tears, lots of these patients are out there. They've been using artificial tears 5, 6, 7 or more times a day. What a lot of them don't realize, and I think, some of them have sort of a concern about cost with some things. What a lot of them don't realize, they're going through artificial tears. They're spending lots of money on artificial tears without really getting to the root cause, which is inflammation. So a lot of this, again, is going back to inflammation. A lot of times we're going to start with a drop, and it's going to be pointed at inflammation. So maybe you could tell us, what drops do we have that help us with inflammation?
So one is something, a mild steroid.
Okay.
People out there think steroids. I think prednisone is one big one. So we use an eye drop that is a kind of a sister drug of prednisone. It's a weak prednisone, but it helps to quickly calm the inflammation down. And at the same time we're doing that, we'll use a drop called Restasis. And probably everyone out there has seen the Restasis commercials, and they've seen this, and it's been out a long time, and it works. With any drug, there can be possible side effects. Itchy, burning, redness of the eyes, sometimes patients will notice, but I find 80–90% of patients do very well with Restasis. Restasis is not a steroid, but what it does is it helps to reduce inflammation by working at a different point in the inflammatory process. And you talked in the first segment about some cells. It helps prevent cells from releasing certain proteins. And that's how Restasis works. So Restasis is a twice-a-day drop. I tell patients you do it when you brush your teeth in the morning, you brush your teeth before bed.
And hopefully they're doing that, and hopefully we're getting them on the right track there with that. And I think that's a really easy thing for them to do and to remember. And so the Lotemax that we mentioned are a soft steroid, and then the Restasis. Is there anything else, anything new out? I've seen some really cool commercials with Jennifer Aniston out recently talking about eye love, giving your eyes some love, and I really like that actually. It's a great catchphrase, and I think it rings with people, and it kind of catches their attention. So what's that all about?
So, interestingly, it's been 13 years since we've had a new drug approved in the United States for treatment of dry eye disease. And, we use nutraceuticals, we use some scrubs for the eyes, we use a lot of things, but this is a new eye drop that works differently than Restasis, that helps at another point in the inflammatory process to reduce the inflammation. And that's the buzzword, is inflammation. This is all about inflammation. And the drop is called Xiidra. It's spelled Xiidra, but it's called Xiidra. That's how it's pronounced. And Jennifer Aniston is the spokesperson for this. But it is really cool technology. And again, proud to say we are the first ones in the large area around that is using Xiidra on patients already. It works. It's a twice-a-day drop, just like Restasis. And in some patients it may burn a little bit, it may sting a tiny bit. Interestingly, one little side effect that goes away is you can get a little metallic taste in the back of your throat, but none of those things are bad things. And I'll explain to patients sometimes, think of if you have a scratch on your hand, you put alcohol on, it burns. Well, your eyes are irritated, you're putting medicine on, it's gonna burn.
Right.
It is gonna burn. And that goes away over time. And again, what you mentioned previously is, we do all of these things for a reason. We have a stepwise approach. We follow evidence-based medicine, and a lot of times things are, like you said previously, multifactorial, which means we need to do multiple things. I tell patients I like to treat dry eye from 3 levels: internally, on the surface of the eye, and on your eyelids. And I know you're a big believer in keeping bacteria away from the surface of the eye. So tell a little bit about that to patients out there.
Yeah, so it's really interesting. 2 really unique lid scrubs that we have here in the office that help with 2 sort of unique parts of our eyelid health. So our eyelid health, we'll look really thoroughly at the cornea. We'll look really thoroughly at your eyelids. And really interesting, when we look at your eyelids, sometimes we see this dirt and debris and scruff on the lids and lashes area. Something we call blepharitis, or inflammation of your eyelids, redness and thickening of the eyelids. So we have a scrub called Avenova. That scrub is directly related to killing normal bacteria that lives on our skin, usually gram-positive types of bacteria that can overgrow and start to cause problems with the oil glands, causing styes or infections of the oil glands, and it can also help the tear film. So that's one. Avenova, very effective for many patients. Another lid scrub we have is something called Clearadex, and this is a big one. There's a skin mite actually that lives in almost everybody called Demodex. Yes, Demodex. And Demodex can cause the same issue, redness and thickening. So we have this scrub here, which is a little bit more of a menthol feel. It's a little bit more burning when you first do it, but it kills these Demodex. And I've had a handful of patients who have really done tremendously on both Avenova and or Clearadex. And again, it's a multi-step approach. We have lots of different things, and not everybody has the same type of dry eye. Not everybody's going to do beneficially with these treatments for dry eye.
And I think the point is, when patients come into the office for every visit, we test their dry eye, we get their numbers. You wouldn't go to your family doctor and check your blood pressure or how your blood pressure is doing without them checking your blood pressure. We can't see how your dry eye is doing without actually testing for that. So we take tear samples at every visit and see how that's going. So it's very important to get that evaluated. It's very important, if you're on treatments, to follow up and see what may be the best for you. Staying hydrated throughout the day, drinking lots of water is very important. Taking your omega-3s, the PRN omega-3, we feel is the best one out there. So there's a lot to do for dry eye. And in our next show, we're going to talk about some more advanced treatments for dry eye that's out there. So we're going to wrap things up. And again, everyone, you've been watching Eye Care Today. I'm your host, Dr. Thomas Kislan. We appreciate you spending some time with us, and we'll see you next time on Eye Care Today.